I will discuss about the topic occupational health. So, occupational health is the study and prevention of environmental problem in worker population within the workplace. Next, coming to the term ergonomics. The ergonomics is concerned with human engineering, that means placing the work in an environment or job which is adapted to his physiological and psychological capacity. The health of the worker is influenced by three factors, namely occupational or working environment, domestic environment, and social security and welfare measures. Next, coming to the occupational environment. The first one is man with machine. First interaction is the man with machine. In almost all the industries, the machines are driven by power, poor installation of machines, the underguarded protruding moving parts, poor maintenance, etc., resulting in accidents. Working for long hours result in fatigue, discomfort and decreased efficiency. Number two, second one is man with environment interaction. The interaction between man and environment has an influence on his health. Number three is, the third one is man with man interaction. The interaction between worker, his co-worker and employer. This depends on many psychosocial factors like job satisfaction, payment, welfare conditions, incentive, etc., which has influence on their safety, security and mental health. So there is three type of interaction: man with machine, man with environment and man with man. Next, coming to the occupational hazards. An industrial worker is exposed to 5 types of hazards. These are physical hazards, chemical hazards, biological hazards, mechanical hazards and psychosocial hazards. Next, coming to the occupational diseases. The etiological agents of occupational diseases I am discussing. First, I am discussing the diseases due to physical agent. The physical agent are heat, cold, light, pressure, noise, radiation, mechanical factor and electricity. So due to the heat factor, the disease condition will be heat hyperpyrexia, heat exhaustion, heat syncope, heat cramp, burns and local effects. Due to the cold agent, the disease condition will be trench foot, frostbite, chilblains. Due to the light agent, the disease condition will be occupational cataract, Meniere's nystagmus. Due to the pressure agent, the disease condition will be Caisson disease or ear embolism. Due to noise, there will be occupational deafness, cancer, leukemia and aplastic anemia, accident and burns. Disease due to chemical agents. So the chemical agents are gas, inorganic dust, organic dust, metal and their compounds, acid, alkalis and pesticide. Due to this chemical agent, the disease condition, occupational disease condition will be gas poisoning, pneumoconiosis, bagasosis, bicyanosis, tuberculosis and farmer lungs, lead, mercury, cadmium poisoning and lastly burns. Next, coming to the biological agent. If the causative agent is biological agent, then the occupational disease condition will be brucellosis, leptospirosis, anthrax, actinomycosis, tetanus, encephalitis, etc. Next, coming to the occupational cancer, cancer of the skin, bladder and lung. Occupational dermatitis are dermatitis, eczema. Disease of psychological origin are industrial neurosis, hypertension, ulcer, etc. Occupational disease of agriculture worker are anthrax, leptospirosis, tetanus, snake bite, respiratory disease, solar radiation. Occupational disease to healthcare workers are infection like HIV, hepatitis, TB, backache, mental stress, varicose veins, and lastly sleep deprivation. Next, coming to the occupational disease to the computer professionals are carpal tunnel syndrome, dry eyes, cervical spondylitis, insomnia, and lastly backache. So here I have discussed the occupational diseases due to the physical agent, chemical agent, biological agent, and other factors also. Next, coming to the few factors which influence the pneumoconiosis are higher the concentration of dust, greater the health hazard. The permissible limit is 200 microgram per cubic meter of air. Composition of dust is also an important factor. More the complicated composition, greater the health hazard. Size of the dust is another important factor. Smaller the size of dust particle, greater the tissue reaction. Next, duration of exposure also determine the disease condition. Longer the duration of exposure, greater the health hazard. Next point, it is very important that individual response also determine the disease condition. If the health and nutrition status of the individual is better, lesser the chances of pneumoconiosis. Not only pneumoconiosis, for every disease also. Next, coming to the common pneumoconiosis causative agent and the industries of occurrence. First is from dust. The name of the disease is silicosis, means from the silica dust the disease caused is silicosis. From asbestos it is asbestosis. From iron it is siderosis. From coal dust the disease is anthracosis. From aluminium the disease is aluminosis. The barium dust is bitosis. From organic dust it is cotton dust biocinosis. From sugar cane dust the disease is bagasosis. From tobacco dust the disease condition is tobaccosis. Moldy hay grain dust the disease condition called the farmer's lung. Next, coming to the lead poisoning and its prevention. Lead poisoning is called plumbism. There are two sources of lead poisoning, that is occupational and non-occupational. First one is occupational type of plumbism, means lead poisoning is common in lead ore, glass paint, paint printed potteries and plumbing work industry. Next, coming to the non-occupational source is by automobile exhaustion water supply through lead pipes, spray with insecticide containing lead, children having pica or eating lead containing mud, etc. Next, diagnosis of lead poisoning. The specimen of blood lead normal level is 25 to 40 microgram per 10 ml and the dangerous level is 770 microgram per 100 milliliter. In urinary lead specimen, the normal level is 0.2 to 0.8 microgram per liter and the dangerous level is 70.8 microgram per liter. As we know, the prevention is required to combat the occupational disease. First one preventive measures is pre-placement examination. So, the pre-placement examination consists of thorough examination of the individual before giving the job. It includes the physical examination, routine investigation, include chest x-ray. The suitable job should be given depending on the physical and mental abilities that is fitting to the job for the worker. Next, coming to the health education. Employees at risk of pneumoconiosis are educated about the hazards of dust inhalation. They are educated about the hazards of smoking and precipitating factors. Provision of healthy physical environment will also prevent the disease. Adequate ventilation, good housekeeping are mandatory in the industries. Prevention of formation of dust at the point of origin by water sprays. Prevention of escape of dust in the environment also is very important. Keeping moisture content below 20% and spraying 2% propionic acid controls bagasosis. Next, coming to the early diagnosis and treatment. Workers should go for periodic medical examination including chest x-ray to detect the disease condition at early stage. Next, coming to the disability limitation. This consists of limiting the further disability of worker by detecting the slightest degree of disability and immediately assigning other job. Next, coming to the rehabilitation, it requires for the worker who have become handicapped due to development of fibrosis. So here I have completed up to the preventive measures of the worker for occupational diseases. The next class will be the continuation class of the same topic, occupational disease. Thank you.